Good afternoon. My name is David Blacker. I'm your Bell County Judge. I've got some remarks that I'd like to make first. I'm going to go through those remarks and the announcement that I have today. And then I'm going to recognize some visitors that I have here today to let them offer a few comments, and then we'll get to Dr. Chadwell after those remarks. As many of you know, on Monday this week, the governor held a news conference. At that news conference, the governor said, quote, "To state the obvious, COVID-19 is now spreading at an unacceptable rate in Texas." Close quote. The governor then pointed to some large charts showing trend lines for hospitalization, daily new cases, and positivity rates across the state. All of the charts showed some flattening until about Memorial Day. Then, after Memorial Day, spikes were depicted on all three charts. The governor then added the following statement: "If those spikes continue, additional measures are going to be necessary." I, like many of you, have been watching and monitoring the numbers here in Bell County. I've been doing so since the beginning of the pandemic. Bell County Public Health District COVID-19 dashboard for yesterday had the following numbers on the board: 819 confirmed cases, 23,278 tests, 86 ever hospitalized, 38 ever admissions to the ICU, and a 7-day average as of yesterday of 26 new cases a day. For comparison's sake, on May 23rd, our 7-day average new cases a day was 7. I've also had one physician, a local area physician, send me his own audit of our testing and positivity rate over the past 60 days as he's assessed the numbers. By his calculations, our May positivity rate, which is the number of positive cases to the number of tests, was 4.5% in May. In June, our positivity rate was 9.3%. In other words, people are now testing positive at almost double the rate we were a month ago. But here is probably the most concerning data point that I have seen, and that is for our region, which is in the state system called Trauma Service Area L. Out of 1,027 total staffed hospital beds that are available in Trauma Area L, which includes Bell County, and Bell County makes up the majority of that region, 79% of those hospital beds are now occupied. And there are only 13 ICU beds available as of 3:50 p.m. yesterday in the entirety of the Trauma Service Area L. I've been advised also by the largest private healthcare provider in the county that they now have in the hospital the largest number of COVID patients they have had since the beginning of the pandemic. That is concerning to me on several levels, and I'll come back to one of those in just a moment. I also asked that institution if there were concerns about hospital capacity and their ability to continue to operate business as usual. The answer was yes, we do have concerns about hospital capacity at this time. That is concerning to me. As I've shared with you in the past, our healthcare industry, nationally and locally, operates on razor-thin margins when it comes to available beds. Normal business operations at the hospitals mean most of the beds are filled most of the time. A surge in COVID patients is disruptive to that normal business operation for the hospital and could cause the hospitals to take some backward steps in terms of deferring elective surgeries in order to free up bed space and reallocating resources that would otherwise go toward non-COVID healthcare and not just for elective surgeries. This is not a direction that the hospitals want to go. It is also a direction that I don't want our healthcare providers to go. When the governor first announced the reopening of the state under his plan, he indicated his concerns were trying to balance competing interests, but always the prime interest was the health of the citizens and the residents of the state of Texas. But he was also trying to balance that of commerce and economy with the reopening of the state and the health concerns that the COVID pandemic presents. He's been very consistent about pointing to things on the charts that he had behind him on Monday as the health indicators that he watches to see if this balance between reopening and restricting is in fact balanced. I think both the statements he made on Monday are very telling to us that COVID is spreading at an unacceptable rate, and that if the spikes continue, additional measures are going to be necessary. I think the message that he's sending us is that if we don't turn those numbers around, he's prepared at the state level to step back in and issue more mandates. In fact, I think the message we will see is a return to some measures that none of us want to see return. 3 things the governor stressed: washing your hands, maintaining your social distancing, and wearing face coverings. The governor has also indicated that a one-size-fits-all approach to dealing with COVID-19 around a state as large as Texas is not appropriate. I applaud the governor for allowing the authorities to assess their local situations and take measures that are appropriate for their individual communities. What may be necessary in Harris County may not be necessary in Bell County, and what may be necessary in Bell County may not be necessary in Llano County. I think this approach from both a health and a policy perspective makes sense. So in line with the governor's orders and comments, and after reviewing our local situation, discussing the matter with our area cities, our chambers of commerce, our healthcare providers, our public health district, I'm today issuing Directive Number 7, which relates to the wearing of face coverings. The short version of Directive 7 requires all businesses that provide goods and services to the public to implement a health and safety policy, which mandates the wearing of face covering when on the business premises where social distancing is not feasible. Directive 7 strongly encourages wearing of face coverings when in public places where it is difficult to maintain social distancing. This directive is intended to mitigate the spread of COVID-19 in our community. This directive is intended to help stem the trend lines that we're now seeing in new cases in Bell County and to help us maintain our hospital capacity in Bell County. I do not issue this directive lightly, but with the numbers we're seeing and the trends that we're seeing, I issue this directive in the hopes that we will stave off additional directives or orders from the governor that will be much more intrusive. I don't think any of us, me included, want to see us go back to a point where businesses are being closed again. By implementing this measure at the local level and across the county, I think it provides us with the best opportunity to balance the reopening of our economy and maintain that reopening and the flow of commerce across our county with the health concerns that have been associated with the COVID-19 pandemic. At this time, what I'd like to do is I have 2 mayors here with me today, the Mayor of Killeen and the Mayor of Temple, and I've asked both of them if they'd like to make any comments, and both of them indicate that they would like to make some comments. So at this time, I'd like to introduce Mayor Jose Segura from the City of Killeen.
All right, thank you, Judge. I am here in support of the judge's directive. I know that he did not come to this decision lightly. We had met on Monday and I made my recommendation, but I know that knowing the judge and knowing what he did his own due diligence. He went out there and talked to our stakeholders and stuff before he made that decision. So it wasn't just my recommendation that made him do that. And for that, I am grateful because I think that it's important that it is countywide because we have different cities throughout, but we're always crossing that line. And I think that this will definitely help mitigate the spread countywide. And so very appreciative, and hopefully this will prevent us. And my concern is that we have a lot of businesses in our city, throughout all of our cities. But I think that what we're doing here will prevent us from taking that necessary step that we took originally, where we had to shut down a lot of businesses, and people need that to continue operating. I'm one that, you know, I freely admit that I do not like wearing a mask, and but for the safety concerns of our citizens, for the safety to make sure that this does not continue to spread, I've made my directive to let the judge know that, you know, I feel strongly that this should have been done, this should be done. And I think it's important. And so with that, I just want to say, you know, I'm very fully supportive of that decision. The one thing that I do want to let people know, because as mayor, I do get a lot of response. I've gotten a lot of emails, a lot of calls the last couple of days, people either for it or against it. And we just want to clarify that if you are a citizen out here, you're a citizen in Killeen and one of our cities, this doesn't mean if you do not wear a mask outside, you're going to get fined. So I just want to clarify that, because a lot of people think that, you know, we're going to be out there fining citizens. This is more for the business to create a health plan in their business and to ensure that people coming into their business wear a mask. So with that said, thank you, Judge, for taking this tough directive. I know its decision did not come lightly, but very appreciative, and hopefully we can see some light at the end of the tunnel here. So with that, I'll turn it over to our next mayor.
Thank you, Mayor. I want to echo both Mayor Segura's and Judge Blackburn's sentiments regarding masks and this mandate within Bell County. This was not a decision that was come to lightly. As Mayor Segura mentioned, that all the mayors in Bell County got together, had a long, fruitful discussion, and ultimately it came down to the judge's decision. I know it wasn't an easy decision, and in many cases, based on the feedback I've received from citizens of Temple, it's not a popular decision. But again, I think it's important that we as a county work hard toward keeping everyone safe, keeping everyone healthy, both for the exchange of commerce, but also just taking care of each other. One of the shocking statistics that's coming forward now is that the largest demographic that is being diagnosed now are those that are 20 to 29 years old, which those folks are typically the healthiest among us. And so even though they may not have any serious health conditions, they could possibly be taking that home to their children or taking that home to their parents. So it's just very important that I believe right now that we are all working together, that we give each other plenty of space, that we're respectful of each other. And if all it takes during this pandemic to possibly save each other from getting sick and to preserve commerce is to simply wash your hands, social distance, and wear a mask. In my opinion, although that is intrusive, wearing a mask, it's not something that's impossible to do. So my thought is just out of respect for each other that we be very diligent and deliberate about wearing our masks and taking care of ourselves so that we're taking care of our neighbors. Thank you.
Thank you, Mayor Segura. Thank you, Mayor Davis, for your comments. At this time, what I'd like to do is go ahead and call on Dr. Chadwell, let her give her report and go over the numbers. And then we'll certainly open it up for any questions you might have. I'll ask the mayors if they have time to stick around for a little while. So if there's any questions you want to direct to them, they can also be responsive to that also. Dr. Chadwell?
Let me go ahead and get the mask off. Give me a second here. Good afternoon. I'm going to go ahead and go through the numbers as of about noon today. So these will change a little bit, but I'll give you a preview. And then there were a couple of questions that were posed via email, so I'll go ahead and answer those. So to start with, as of noon today, we were up to 862 cases. That's 43 more than the day before. Some of those were from late yesterday, so you'll see those split between today's count and yesterday's count. And the cases, again, do trend younger, as mentioned previously, and there are three major reasons for that. And it's not going to be one of these reasons, it's a combination of the three. The first is more testing, particularly of those with mild illness, and we've noted that before, but that's not all of it. It's additionally, the elderly are continuing to be careful, they're continuing to exercise caution, but probably the biggest driving force here is that the young are being less cautious, which is why we're seeing that spike in that 20 to 29 age group. And if any of you have spent time going around the community to look and see what's happening, you'll note the same thing I've noted, which is more gatherings, more people just kind of pretending that COVID doesn't exist, which certainly is not the way we should be behaving. We have added 3 more hospitalizations to our data so far, and 2 of the 3 are in ICU. And that's, again, as of noon today. And I was asked a question about current hospitalizations, so I did pose that question to our local hospitals in the data I was given, because we don't always get notified about discharges for every single person, which is why we used ever hospitalized in our data. But the data I was given today indicates 15 hospitalized, 11 of those are in ICU, and all but 2 of them are over the age of 60. The 2 that are not have significant comorbidities contributing to the severity of their illness. And let's see, the last question asks about whether or not protests have contributed to the rise in cases. That alone is not a contributor. I'm sure it's part of a contribution because it is a type of gathering, but certainly not the only contributor. The things to make sure we're aware of is that people are not social distancing at the rate that they were previously. There are gatherings of a variety of types that are occurring across the community that are contributing to these trends. We're seeing reduced use of masks, reduced hand washing, just reduced COVID prevention behavior across the board. And frankly, it's COVID fatigue. We're all very tired. We're tired of hearing about COVID, but it is still here and it is still potentially dangerous. Do you want to pause for questions? All right, questions?
I'll close one. Mr. Temple, you said something yesterday that was really pretty concerning and kind of set the stage for today.
Sure.
About people you see. Can you repeat that for me?
I don't remember the exact quote, but you should assume anyone around you may have it.
It's that bad.
There are a number of people that are asymptomatic, and we're seeing the rates increase dramatically enough that we've had people ask questions about, is it safe to go here, there, or wherever? We can't say that because it is legitimately everywhere in the community, and that's what community spread means. It's widespread.
There's no escape unless you leave the county.
Prevention, social distancing, stay home, avoid gatherings, all the things that we've said, that is the method that you take to approach it. Anything else?
Hey, Dr. Chadwell, Jacob Gelbrand.
Hi, Jacob.
I was wondering, when should people wear their masks? Like, I know I'm using when I actually wear my mask, but if I go to get coffee from Starbucks and drive, when should they wear masks?
So whenever you cannot guarantee that you can socially distance from others. So for me, for example, if I go to the grocery store, I'm masking. I generally make sure I have a mask on me when I leave my house. If I go into a business, I'm wearing a mask. When I am at work, if I'm solo sitting in my office, I may or may not wear one, but I typically do because you never know when someone's going to barge into my office and need something and be closer than 6 feet. So generally, if you cannot guarantee you can be 6 feet away from another person, put a mask on.
Hi, Dr. Chadwell. This is Wolf with the 6 News. I was wondering, in the directive, it was mentioning that you don't need to wear a mask when consuming food or drink. When it comes to restaurants and bars, can we discuss how that kind of will play out, what that will look like? Do people need to, every bite, put their mask back on and chew it and then take it back off, or what is that?
I'll let the judge address that question because I did not write the order, but I have a feeling I know what the answer will be, but I'll let him address that. There was another question?
Yeah, this is Megan with KWCX. Do you know how many ICU beds we have in Bell County and how many of those are in use?
I did not look at those numbers since I didn't get that question ahead of time, so I'm not sure, but the Trauma Service Area L data would give you a pretty good view of that. I can see if our hospitals have a better idea, but I don't have that number in front of me.
Okay, and my other question for you, you've been encouraging masks and social distancing, all of these things since pretty much day one. Obviously, we've seen this increase in the last few weeks, which I guess would tell us that people weren't really listening. I guess just from your perspective, are you happy to see that there is now some kind of force and that some of these recommendations are maybe going to be seen through and we might see some progress with this?
I'm happy that my recommendations are generally well heard and that our elected officials have been paying attention to the data. They've been very data driven in their decision making. So I've certainly been happy to see that. Anything else?
Yeah, I have a question, another one. I've kind of been tracking the testing numbers in a Google Doc. Can you kind of explain how they have reported to you again? I'm kind of noticing this ebb and flow where there's a lull on the weekend, and when we get to Wednesday or Tuesday or Thursday, there's this high. I was just hoping for a little timeline explanation.
Sure. So we have our local hospitals. They send me emails during the week when they're working. Our infection preventionists don't usually work over the weekend, so I don't get data reported to me over the weekend. So any testing that was done over the weekend is usually reported in on Monday. So they don't report over the weekend, which is why you're seeing less data reported then. And there's also the fact that we partnered up with the county in order to do the GIS dashboard, and they don't work on the weekends either. So unless there is a major jump in the numbers, I tend not to ask them to work on their day off. But yes, so they report those to me via email, and then I add those to our total. Anything else? Okay.
Thank you, Dr. Chadwell. All right, I'll be happy to take any questions you might have for me or for the mayors.
Hey, Judge, it's Jacob. Thanks a lot, man.
Hey, Jacob.
I read through the directive, and there's nothing that said, there's no enforcement. Can you kind of talk about the enforcement and if there's a fine or not for businesses?
Yeah, there should be some language in there for enforcement, and if not, then I'll correct that. But the enforcement provisions associated with it will be fine only. It's the same language that I saw in probably a dozen other county orders, city orders that I reviewed as I drafted the order. We expect enforcement to be handled by any law enforcement officer, just like the governor's orders have indicated from the beginning also that the orders are enforceable by any law enforcement officer. So that could be a city police officer, it could be a deputy sheriff, it could be a constable, it could be any law enforcement agent in the county.
How much is the fine?
Fine would be up to $1,000.
And similar to when people could report businesses that weren't following other orders, will the phone line be open? Is that something you're encouraging people to do, to call in recommendations, or you guys are handling it?
That is correct. There will be a phone line activated, should be activated by this afternoon. The phone number for questions is 254-939-5203. Again, that's 254-939-5203, and that should be active Monday through Friday, 8 to 5.
Hi, this is Cole Johnson with 6 News. I just wanted to follow up on part of it, saying that you don't have to wear a mask when eating or drinking. Can you lay out how that will work, certainly in restaurants and bars? Is it once you get your food, you can take your mask off? Or once you get your drink at a bar, you can have your mask off? What does that look like?
Yeah, my hope is that common sense will prevail. And that said, again, mask in, you sit down at the table with your spouse or friend or whoever, food and drinks, take your mask off to eat and sip. I don't think it will be that complicated for folks to figure out. Any other questions?
How long?
Oh, okay, Mayor.
Sorry, I've got to. Thank you. That's a good question. The question was, how long does the directive last? And when does the directive begin? It is effective at 12:01 a.m., which is midnight on Monday, June 29th, and will continue through 11:59 p.m. Monday, July 13th. Again, that's listed at the top of the page on the second page of the directive. And I wanted to give businesses and the community some time. So this is Thursday afternoon. So again, it will go into effect on Monday next week. Any other questions?
What do you tell residents who go on social media and say, my body, my choice in regards to masks?
My first comment would be that there is if they haven't heard, there's a COVID pandemic occurring. I think a lot of the conversation, and I certainly respect individual rights and all of those arguments that I've heard and that we have heard, all of us have heard over the past 90 days or so since this has begun. But I do think the measures that are being implemented today are much less intrusive than measures that, say, for example, close businesses. And I think what we're trying to do is mitigate the spread of this pandemic so that we don't have to take more drastic measures. And I think I think the conversation needs to shift to some degree from the I and the me to the we.
You mentioned the fine for businesses if they're not complying. Is there a limit if So let's say they get a fine, but they still continue to not enforce masks. Is there a next step up, or is it just a continual fine if they keep getting reported?
It's per violation. So it could be per day.
I have another question for Dr. Chadwell, if she's available.
Yes.
What's your question?
Yeah, we just got a call from one of our viewers asking about getting tested. They say that they were having, not being able to get one. Any tips on where people can go, and do they still have symptoms, or can anyone get a test? We just want to clarify that for her.
So for some of the providers, I have a hard time speaking for them. Typically, they're only testing people who do have symptoms or have been directly exposed to COVID. We generally encourage anyone who is trying to get a test to contact their provider and see if they're willing to test them and follow their provider's advice. That's really the best thing that we can do for them, because we can't mandate that providers test people. There have been certain cases where individuals have gone to other jurisdictions to do that. I don't know if that's something that they can do. I have seen that done. But if the provider's not willing to do that, then there's not really a whole lot I can offer.
Thank you.
Dr. Chadwell, while you're up there,
Yes.
can you talk about the age element that comes with masks, specifically for maybe children under 10 or something, what your recommendation is for parents?
We follow the CDC recommendation, which is that children under 2 should not be masked. And I do believe that was mentioned in the directive. Anything else?
Thank you, Dr. Chadwell. I need to make a correction on the phone number that I gave you earlier. I misspoke on the number. So here's the correct phone number: 254-933-5203. Again, 254-933-5203. Again, we'll be updating our website this afternoon and pushing out quite a bit of information on this directive, as well as some sample signage and those kinds of things. Any other questions?
Jeff, I know you briefly mentioned this, but you were talking about the gap between this and when the directive begins. With the increase in cases going up so much more now with these new spikes, can you just reiterate why there's this gap between when it's beginning?
So simply wanted to give businesses some time to adjust. As the directive, as you should have a copy of that directive, but the directive requires a health and safety policy be adopted and implemented. That doesn't have to be complicated, but nonetheless, it is a document that the businesses need to create. There's some signage that's required to be posted on the business. Again, face covering is required for the staff at that business. So again, it's to give those businesses a little bit of time to prepare for opening on Monday to be in compliance.
Thank you.
And Judge, do you have any specific recommendations for schools or daycares on this order?
Well, my suggestion would be to follow the order as best you can. Again, with the recommendations that have been put in place, again, wash your hands, maintain social distancing. When you can't do the social distancing, wear your face coverings. I mean, all of those things apply really across the board, whether it's mandatory or whether it's a recommendation. We would continue to urge those three things. As was said earlier, the health authorities have been recommending those three strategies almost since day one in this pandemic. What we're simply trying to do is reinforce those measures as best we can in as many sectors of our community as we can.
One more for you. I believe this was touched on when the cases at the Bell County Jail were first announced, but can you just reiterate, we have some people asking on Facebook, are inmates getting access to masks and what the status is inside the Bell County Jail?
Yes, thank you. Yeah, the question is, just a jail update in terms of our COVID situation there. As reported about a week ago, I think, but we do have some active cases, inmates and staff at the jail that have tested positive for COVID. All of the inmates that have tested positive are in a quarantine area or in a lockdown area. Jail staff is regulated in and out of that area. They're in full personal protective equipment gear as they go in and out of that area. The jail staff that has tested positive is not at work, so they are at home isolating. Jail staff or the inmates have 24/7 healthcare provided to them at the jail. We contract with a private healthcare provider, and that provider is overseeing those care services, not just for the COVID patients, but for all of the inmates at the jail. Any other questions?
I have two more, Judge. First one's about 4th of July. We have events planned in Belton, concerts at Shoves. Temple has their drive-in fireworks show. Has there been any discussion among you and our local officials about possibly changing these plans as the county has seen these spikes in coronavirus cases?
A question again was on 4th of July activities and events and discussions that have occurred relative to planning those in light of COVID. The short answer is yes, there have been multiple discussions, at least that I've been involved in, with area cities as well as area event organizers. The goal and objective on all of those is to carry out the intent of this directive, which is to mitigate the spread of COVID-19. And so what we talk about is minimizing interaction, social contact, maintain social distancing to the extent that you can. I think, for example, the Temple 4th of July fireworks celebration, at least the plan that I reviewed on that, had implemented all of the measures that we're talking about in this directive in terms of trying to maintain that social distancing. So I think at least all of the plans that I've reviewed with regard to the 4th of July events and activities in the area have been very, very cognizant of the COVID situation and have made, I think, extraordinary efforts to try to mitigate, again, the social contacting that might occur during those events.
Then my other question is, what do you tell residents who may be afraid as they're seeing these numbers increase? What do you kind of tell them to assure them everything's going to be okay?
Well, again, thank you for the question. The question is, what do you tell folks who might still be concerned or concerned about it? I would tell them that follow the directives, follow the measures that are being recommended by the health authorities, especially if you're 65 and older, if you have underlying health conditions. Those folks have been identified early on as being high risk. And if you're a high risk, then the recommendation from the governor's office, from my office, from the health office, health district offices here, is stay home as much as you can. Limit the number of visitors that come to your home. When you do have to go out, wear your mask, maintain social distancing, wash your hands frequently. All of those kinds of things you just need to continue to be very vigilant about, especially if you're, again, in a high risk category or if you have heightened concerns. Again, I would urge you to follow all of those directives. Any other questions? All right. Thank you for your time today.